is Dr. Poornima
Go ahead,
Mathur.
ma'am.
Good afternoon, everyone. This is Dr. Poornima Mathur. Like every time, today we are here to discuss something new again. But this is not new. PCOS is something we've all heard about. हम सबने सुना है और कभी ना कभी at some point of our life, we must have diagnosed ourselves with it as well. So first and foremost, we are going to discuss what is PCOS, and I will try to bust a few myths regarding it. So we all know what is PCOS. Now, at this point, let me clarify. Old school terminology was PCOD, जब हम इसको एक disease मान के चलते थे. But now it is called a syndrome because जितनी studies हुई हैं, the way scientists have researched, हमें पता चला है, this is basically a syndrome because the hormonal changes that happen in your body, they are not just affecting your periods or your cycles. It affects so many systems in your body, इंक्लूडिंग आपकी कार्डियोवास्कुलर हेल्थ, आपकी हार्ट हेल्थ को लेके, आपकी मूड स्विंग्स, आपकी स्किन टेक्सचर. सो इट इज बेसिकली अ कॉन्ग्लोमरेशन ऑफ सिम्टम्स, हाउ द हार्मोन चेंजेस आपकी बॉडी को अलग अलग तरीके से अफेक्ट करते हैं. हेंस वी आर यूजिंग पीसीओएस. सो नेक्स्ट टाइम व्हेन यू सी समबडी सेइंग कि भाई मुझे तो पीसीओडी है, तुझे पीसीओएस, नाउ इट इज यूजुअली कॉल्ड पीसीओएस ओनली. Now, why such a hue and cry about PCOS? Why is it one of the most talked about? Be it social media, be it lectures anywhere. You see, everybody talks about PCOS. Why are we so concerned? Because it is one of the most common endocrinopathy. Endocrinopathy मतलब something जो आपके endocrine and the system को आपके hormones में affect आते हैं. So this is the most common symptom disorder जिसमें आपके hormones affect होते हैं in women. And it affects as much as 5 to 10% of women जो reproductive age group में है, that is 15 to 35 years वाली जो young girls हैं उनमें. It has many symptoms. Now आपको पता ही होगा, like we've heard कि अगर irregular cycles है, हमें excessive hair growth है. So why are we worried about PCOS? Apart from the incidence कि भाई 1 in 10 women या 6 to 10% of women in the reproductive age group, why be worried about it? Because 50% of the women जो होती हैं PCOS की, they are not diagnosed only. उन्हें पता ही नहीं चलता कि what are they dealing with, and they suffer in silence. Why are we worried? इसका कोई long term sequelae होती है? Yes, we are worried because of the morbidity that is associated with it. If you have PCOS, now 50% of women जिनको PCOS diagnosed होता है, they are at risk of developing diabetes in later life or pre-diabetes होते हैं before the age of 40. That is why we are worried about it, because PCOS is going to have a long-term sequelae or long-term effect on your body. It increases हमारे अंदर कुछ cancers के incidence की rate जो है वो increase हो जाती है. Say for instance endometrial cancers. People who have PCOS वो fertility के लिए struggle करते हैं. Hence we are concerned about it. Now, how do we diagnose it? What are the treatments? We've heard so much. So सबसे पहले let's see what are the symptoms. अगर किसी को PCOS है, so how do you know कि fine we need to go and get evaluated for it? आपको नहीं पता चलता what is polycystic ovaries. You cannot diagnose yourself with that. So आपके पास symptoms क्या क्या होंगे? You will have cycles that are irregular. Irregular मतलब हमारी less than 21 or more than 35 days की cycle हो, that is known as irregular. Now, when we say irregular cycles, हम OPD में we regularly see that young girls who are in this school, now उनके periods start होते हैं when they are 7th 8th standard में, 11 12 years की age में, when their periods start. At a very young age of 14 15 years, their mothers bring them कि मैम इनको तो PCOD diagnosed है, we are taking medicines. Now let me be very clear. First 1 year of start of your periods, अगर आपको periods start हुए हैं उसके first 1 year में you will have irregular cycles, and that is normal क्योंकि आपकी body adjust हो रही है, regulating hormones को settle कर रही है, so that 1 year में you can have irregular cycles. Now, before we term somebody as कि इनको PCO ovaries है, so this ultrasound पे जब हम diagnose करके कहते हैं कि ovaries, that is preferably done when आपके periods start हुए at least 8 years हो चुके हैं. So somewhere you are around 24 25 before we can say कि आपकी ovaries are polycystic due to PCOS. Because young girls में it is very common to have ovaries जो ultrasound में polycystic दिखती हो. But that does not necessarily mean you have PCOS. That can be normal as well, because this is how your ovaries are transitioning into the adulthood. They are also maturing. So that we have to remember when it is normal and when it is not normal. So if you have irregular cycles less than 21 or more than 35 days, या आपको पूरे 1 year में less than 8 cycles आती हैं. If you have excessive hair growth, now when we say excessive hair growth, it can be on your face, facial hair, that is your chin, below your nose, your ear, or on your abdomen, or lower back, or inner thighs. Excessive hair growth. If you have acne, skin pigmentation. Now, skin pigmentation in PCOS can be as a manifestation of anti-insulin resistance. If you have darkening of the skin, if you feel that my skin is unusually dark on the nape of my neck or your elbows or flexes, you have excessive hair loss, a little male pattern hair loss. Yeah, we have a weight gain. When we say okay, the weight gain is very stubborn, you are not able to lose it properly, or you are having difficulty in conceiving. These are the common symptoms जो आपके PCOS के होते हैं. Now, how do we diagnose ourselves with PCOS? Now, it is very common. Every time a young girl walks into our OPD says, "Ma'am, मुझे cycle irregular हो रही है." Can it be because of PCOS? Now, I think it is PCOS. मैंने देखा, I saw it on the social media, and I've started doing these things to regularize my cycles. Now, the diagnosis of PCOS should be something that your gynecologist does. You consult a gynecologist. Now, there are certain parameters that we evaluate. A total holistic examination would happen, and there are certain criteria which we have which help us diagnose whether or not you have PCOS. Now, having been so common, there are certainly many myths associated with it. कि PCOS में ये होता है, ये नहीं होता है. So let us try to answer or address certain myths which are associated, the most common ones here. Now, the first myth is we think that everybody who has PCOS is either obese or overweight. Now, when we are talking about obese or overweight, see, now although 80% of women who are having PCOS, उनका weight ज़्यादा होगा. Now, how do we say weight ज़्यादा? We would be a parameter where we are seeing the body mass index, that is the BMI. The BMI is more than 25, she would be overweight, and more than 30, she would be obese. Now, 80% of women are obese or overweight, but there are 20% women who have lean PCOS. Now, lean PCOS, उनका weight बिल्कुल normal लगेगा, वो बिल्कुल fit लगेगी. Now, having said this, now lean PCOS जो है, that is usually ignored. People do not diagnose them with PCOS. कि भाई आप तो fit हो, आप healthy हो, how can you have a PCOS? So now lean PCOS women also have the same risk factors. They have the same morbidity that is associated with PCOS. The hormonal changes are also the same. Though they don't need to lose weight, unlike the obese PCOS women, they would need a gynecologist intervention to regularize their cycles or unwanted hair growth and have a healthy life. Now, the most common another myth that is associated with PCOS is having ovarian cysts. Now, people come and say they all dreaded कि मैम हमें तो कह दिया कि हमें PCOS है और हमारी ओवरी में बहुत सारी cyst हो रही हैं. So, let me tell you one thing. This image that you can see, this is a normal ovary and this is an ovary with a cyst. Now, PCOS may we have multiple small follicles. These follicles are your eggs which are present in the ovary, but they are very different from the cyst. Now, these tiny follicles, they represent your eggs. They fail to grow into a mature egg in every cycle. They are not cancerous. They are not going to cause any pain, or they're not going to cause any symptoms because of the cyst, apart from the PCOS symptoms. Now, when we talk about cysts are usually bigger. They have different natures, which can be a simple cyst or follicular cyst, जिसमें से fluid भरा हुआ है. A benign tumor वाली cyst, like a dermoid cyst, which उसमें cancer नहीं होता, but it has to be removed. An endometriotic cyst, or it can be a cancer valley cyst. So one thing is an ovarian cyst is different, and when we say a polycystic ovary, it is different, which has multiple tiny follicles. And just to highlight, though it is a polycystic ovarian syndrome, PCOS के कुछ variants ऐसे होते हैं जिसमें the ovaries do not have this morphology. They do not have these tiny follicles. Now, the next common thing that people say is if we have an irregular menstrual cycle, it means you have PCOS. More very, very common in college girls who come up to me and say, Ki, ma'am, I have irregular cycles, I have PCOS, and I want to consult you for that. So there now when we talk about irregular cycles, PCOS is one of the causes, one of the many causes that can give you an irregular cycles. But it is not the only cause. There can be very many other causes as well. The most common is you have stress, you have your exams, you have your work pressure, you are stressed and your cycle gets delayed. That is stress. If you've been gaining weight, morbid changes in weight, you are obese, that can lead you to irregular cycles. If your thyroid levels are fluctuating, you're taking any pills, that can lead to your irregular cycles. Or if you have any other gynec causes like fibroids hai, endometriosis hai, or you have certain psychiatric medications which can delay your cycles, or eating habits like anorexia, bulimia, which can affect your hormones and lead to irregular cycles. So before we jump to a conclusion that an irregular cycle is can be due to PCOS, you need to get yourself evaluated where we can have a thorough examination and ultrasound to determine what exactly is the cause. At times, you tend to believe that you have, you're under this belief notion that you have PCOS. Keep treating yourself according to what you hear. Maybe your friend has got a treatment for it, and the original cause is neglected, and it ends up into a more serious problem later on. Next is that we think that all women with PCOS will have excessive unwanted hair growth. So we agree that hair growth जो है, that is a very very common symptom associated with PCOS, and it is a hallmark finding as well. If a person has excessive hair growth, we rule out other causes of hair growth, hirsutism, and we can help you diagnose with it. So now all women with PCOS will not necessarily have excessive hair growth, and all cases of excessive hair growth will not necessarily have PCOS. So, addressing the first thing. Now, when we talk about excessive hair growth, that is on the face or other parts of the body, there are other adrenal conditions also, or certain hormonal disorders जिसमें हमारा excessive hair growth हो सकते हैं. It can be diagnosed with the help of a few simple blood tests, which your doctor can advise and help you diagnose it. Apart from that, there are certain cases of PCOS जिसमें उनकी hair growth बिल्कुल भी नहीं होगी. So we have to remember, apart from this, there are ethnicity, the genetic factors, everything that will affect the expression of this symptom. So we have to remember that every hair growth, excessive hair growth, is not PCOS, and every PCOS does not have hair growth on the face. Now the thing is, people believe that if you have PCOS, you will not get pregnant. So let me tell you about that. Ki PCOS is a common cause of fertility problems where people struggle to conceive. But it's not that every PCOS woman would need help with the help of fertility treatment to have a pregnancy. Now, many women with PCOS can conceive on their own. Now, how do we get that? So when you are dealing with PCOS, it's not necessarily you will have an ovulation. Now, once you have the medical and the non-medical management of PCOS. Now, the mainstay of PCOS ka management, we also believe, is the lifestyle modification. Once you work on your diet, once you start exercising, your hormones start falling back in place. So once things normalize, you can ovulate and you can easily get pregnant even without major intervention. Now, if in case there is a struggle with PCOS, there are a number of options available with the fertility clinics. So I'm starting with something as simple as giving you a medicine and monitoring. So now that is the first line therapy. And if in case that does not work out, we have a stepwise approach where we can go ahead with IUI and IVF also. So conceiving with PCOS is easy provided we take care of the medications, the PCOS management, the lifestyle changes, weight reduction. Usually people can conceive even without help, but if in case your cycles are still irregular despite of taking all the pharmacological and non-pharmacological intervention, you should meet the fertility consultant. If you have irregular cycles, meet the doctor, and it will make it your journey for to conception very very easy. So at the end, I would just like to say, PCOS people, you stay strong, you're brave, you're strong, you're indestructible. PCOS is manageable with lifestyle modifications, and it needs to be taken seriously. It's not about just taking pills and hum PCOS manage kar lenge, because of the long term sequelae with it, the lifestyle fact modifications, that is including a diet change, exercise, is as important as taking a pill to regulate your PCOS, so that we do not have any future morbidity associated with it. We can reduce that and stay healthy. If in case you have any queries regarding how to help to conceive or managing your cycles with the PCOS, how you can manage it at as a non-pharmacological intervention or with medicines, we are here to help you out at Oasis Fertility. Thank you so much. Any questions? No, it does not. PCOS does not. It's not going to affect your sexual factors as well, sexual act performance. But what happens with PCOS, often neglected thing, is because of the changes in the body. People do have a little bit of psychological impact on them. They are more body conscious or body image ko leke, they are more worried about it. So now that is when it affects your sexual performance or sexual pleasures. Now, once we take care of that, it should not affect the orgasm. Is PCS gone after weight loss? Now, here, what I'm going to emphasize is PCOS is not a disease. Hence, we use the word syndrome here. So, it is not a viral infection जो अभी हमारे पास है और 15 दिन में हमारा चला जाएगा. Now, it is basically a set of hormonal changes that are happening in your body. So, एक हमारा होता है कि हमारे जो मेल हार्मोन्स हैं बढ़ जाते हैं, इंसुलिन को हमारी रेजिस्टेंस होती है. Now, when we say that we need to lose weight, we basically exercise, lose weight, and हम insulin resistance को improve करते हैं. So it comes under check. So as long as you are maintaining a healthy lifestyle, आपके symptoms under check होंगे. But the moment you lapse back to an unhealthy lifestyle, you start gaining weight, you stop exercising, the insulin resistance is going to come up. So we are a little bit hereditary predisposed to it. So PCOS per se would stay there, but we keep it under check when we are talking about exercise and weight loss. See, it is, we can say it is a lifetime disease. It is not a disease per se, it is a syndrome. जैसे हमें डायबिटीज होती है या हमें कोई प्रॉब्लम होती है, तो it is there, हम उसको कंट्रोल करके रखते हैं. Similarly, PCOS में when the hormonal variations are there, the resistance is there, it is going to go there, but we put it under control by our modifications. How do you know if your PCOS is getting better? So, one is you start having regular cycles. Next is you can see that your excessive hair growth that is there on your face, that shows a little, it settles down gradually. So at this point of time, I would like to mention, once you start with your medicines, आपकी जो hair growth है, your cycles will immediately come to normal. Well, that is the first thing to settle down. But your excessive hair growth, it usually takes around 6 months or 6 cycles to settle down. So when your symptoms start getting better, your cycles fall regular, your hair growth has reduced, your acne is settled, that is when you know your PCOS is getting better. So I hope I could have answered a few myths that are associated with PCOS. If you have any queries or need any help regarding your cycles or fertility, please feel free to contact us at the given number. Thank you so much.